Hello, I'm Dr. Alan Malik, and welcome to the fourth and final webinar in our series on how to set up easy and effective community-wide screening programs. In this fourth webinar, we're going to look into how you would go about setting one of these up in your particular program or your particular community. And what we're going to do is take all the things that we learned in webinars 1, 2, and 3 and put them together and try to come up with some reasonable planning and what it would actually take to make this thing happen for you. So let's get into it. What we figured out here is that we want to create a sustainable plan. So we're going to get into how do we lay that out and get into all the details around the breadth and the reach and the connection and the engagement and so forth. And then, your next level would be recruiting sites and resources. And then you actually go through the implementation, and then we'll just run through a demonstration of how some of the pieces will work and so forth. But it's all pretty straightforward. You just download, connect, and get going. It's not that big a deal. So laying out a sustainable plan, can be a little onerous in terms of trying to make that whole thing happen. But you kind of break it down and you sit back and go, okay, what are my funding sources? What breadth of guidelines I'm going to take on here? How do I target my connected sites and so forth? And then really kind of lay out what do you think that performance monitoring is going to look like? What kind of training are you going to provide when you get through the whole process? So, it's getting connected and what level of engagement do you plan on using for the program? So let's look at that a little bit. So under the plan, we sit back and go, okay, what are our funding sources? Well, obviously there's grants that are already existing, but you need to think about them in terms of are they startup or are they going to be sustaining grants? And so the idea being that you want to have everybody essentially self-sustaining, self-funded in terms of their capabilities and so forth. And so if you have to create a sustaining sort of program, then you have to worry about making sure that you have that money coming in long term. And then you start looking from the grant perspective. Are you basically expanding on an existing grant? Are you going to try to go in and just do a niche area and so forth? So maybe you don't take on the full program. You just kind of take on some niche areas and try to make some inroads in there. Or do you do the big program, the whole community-based sort of activity? And I think there really are, essentially three different ways of thinking about the world. But at the end of the day, you're going to have some money to work with or not. And then you can go to essentially resources that are essentially already budgeted. So, public health, or you may be looking at this program, you have a certain budget to go about trying to do things and so forth. Maybe that's all that you have available to you. And then start looking at your community resources. There's a lot of people out there creating a lot of good stuff, and so what can you connect to, what's out there. And then finally, you get into this whole idea of, can you actually create these self-sustaining sites? And you may have to work on that. Go out and maybe spend a little time with your medical society and so forth, and try to find some docs that'll push forward into the group. Try to find some of the leaders in that medical community who will step up and look at things from the standpoint of those AAP guidelines and the systemic sort of issues that they have to deal with. And then, try to create some programs around that sort of thing. Those are your best places for the self-sustaining sites and so forth. And then, the next level on your plan is look at that breadth of guidelines that you're going to try to take on. Usually what happens is people just get into the developmental, they're just doing the ASQ3 or maybe the SWIC or something like that, and they kind of lose track of the other stuff that's going on there. And I think what we're seeing more and more is developmental is obviously important. You probably want to, potentially help out on that autism side of that detection sort of activity. You can do it very easily off the developmental stuff. But you also, there's the bigger push, and people starting to realize is you really want to get out there around the social, emotional, and behavioral sort of things. And so the social emotional becoming more important. SWIC covers this sort of stuff. But you can also start thinking about that psych component and start going back on the maternal depression and so forth. And, maybe do some sort of integrated behavioral sort of stuff. And then ultimately, there's been a lot of funding recently about all around the social determinants of health. And so maybe you roll some of that in here as well. And so, you can basically get into not just social, emotional, and behavioral, but you can also look at the social determinants and get those into your programs as well. But you can hook all these together, and that's the big thing about an automated system, is that you can set it up with essentially what we call a screening protocol, and you can say based on age, based on where you're at and so forth, what are you gonna get into? What screenings are you going to do? What combinations of screenings? And you can sit back and a lot of this can get worked out in your roadmap for your organization or whatever. But you need to come up with not just what are the areas you're going to get into. It's kind of like when you're going to get into them and what are you going to use to measure them and so forth. So you set up this age-based screening program protocol. You probably want to get it worked into a community roadmap if you're doing the community-based sort of thing. That's a great way to get other people engaged in the process, get buy-in from other people in the process. And then you also want to think ahead to your aggregate reporting. What are you going to report back on? And so how are you setting things up in terms of those fields and what areas you're going to get into? But ultimately, you're trying to figure out how to make this thing as effective as possible. And then once you got those sorts of things figured out, then you can sit back and go, okay, well, let's start targeting our connected sites. And so your big one that you want to be able to target out there is to get into those screening, get that screening reach pushed out as much as possible. So really get integrated into medical settings. One of the major advantages of working with patient tools is that we've done medical for years and years and years, and we can do that seamless integration in and out of that full integration with that EMR. And that's a big thing to think about. But even making the introductions in the first place and getting that into that medical society, getting those early adapters, kind of breaking down those walls between the medical and the early childhood communities and so forth, and kind of start realizing that you're all on the same side and working together in this whole process. But then get out into your early childhood centers and learning centers and even childcare centers. They can all be doing screenings for you, and they're all interested in the information. And then once you have those sites kind of worked out, then just think how much other stuff do you need to put there? Do you need portals with links, or can you just basically have the individual locations use their own portals and their own links, brand their portals to themselves? I think if you really work through it, you'll find that you don't have to go to that big public portal in the sky and all the cost associated with that. But, in some cases it makes sense, and that's where you want to go. Then look into your, services and resources. It's not just your Child Find and early intervention and so forth, but, your Help Me Grows are trying to create like a single door that you go into and create all sorts of access to all sorts of resources inside of there. And just realize that, it's really important to drive that process. And so you even get to, in terms of the parents themselves, what you're going to find is that if the pediatrician tells them that they should go do something, it's got a whole lot more weight than if an early learning center, director or something like that tells them they should go do something. But long run, the parent really needs to get educated. The parent needs to get the information, and so eventually they'll work that out. And so then, as you're targeting, figuring out what these connected sites are going to be, then you need to think about, what is it going to take to get them to implement, is really what it comes down to. So what is it, can you get all that workload distributed? You don't want to be taking it on in a centralized fashion if you don't have to, all that expense and cost and so forth. So get that workload distributed, get that cost distributed. And then think about what you're going to be doing on your performance reporting. So, kind of set the expectation that we're going to be looking at screening rates. We're going to be looking at the flag rates. I mean, that's kind of natural in terms of the assessments themselves, in terms of what the flag rates will look like relative to the screening. But some populations are far worse than others, and you probably need to pay more attention to those. Then get over to what kind of flag dispositions you're going to be tracking. And that all leads back to, what can you feed back to the providers? What can you feed back to the parents and get them more engaged in their process and better trained for their process? So then off of that, you can do your focus TA, you can do your program marketing, you can go back to the parents, you can do PR, you can do your grants, and just think about all the different places where you're going to use this data. And so you want to get it set up and make sure that you're tracking the right stuff, you're pulling the right information as you go forward. All right, so now we start getting into recruiting. As part of your plan, you sat back and you targeted all these different sites and resources that you want to go after. So now you actually go do it. You actually go take those meetings with that medical society. You go find those docs. You go out and find all of your resources in terms of your early learning and your child find. Make your introductions, get the people connected, recruit them on the idea that maybe they want to put some sort of connection into the system inside their works and be able to track stuff there. So get them involved so that they can actually feed back information electronically and get hooked up that way. And then, at that point, you're going to have to manage logistics and try to manage expectations as well. So that's where, organizing that community roadmap and having meetings around that. Connect up on a concept that we did in the Grand County project and so forth was the idea of creating a community business associate agreement. We actually used some race to the top money at that point to figure out that basically from a HIPAA perspective, medical facilities can share HIPAA, essentially PHI, with one another, but they cannot share it with a non-medical entity. And so when you start hooking in your early childhood centers and so forth, they cannot share that without some sort of business associate agreement between the two organizations. And what they figured out in Grand County is they could just make one common community business associate agreement and everybody sign it. And then they just put every single screening site, every single care coordination site on the same common agreement, and they do it once and get everybody to sign off, and it actually works pretty smooth. And then think about program consent. Are you really going to need program consent? In most cases, what it comes down to is that a medical office using aggregate data and other than treating that individual, so through the essentially anything that's flag and screening related is with the individual, they've already got consent in place just to do that from a medical perspective. And they don't really need it from a program perspective because they can share their aggregate data. It's part of, they can use data as part of their business. And so they can share that aggregate data without a problem. What you don't want to be doing, obviously, is sharing anything that's PHI related or clinically related to a specific individual. But, you may find that you need program consent. In most cases, you do not. Once you have that plan worked out, you've recruited, now you can turn around and just start implementing. And implementation is pretty easy. I mean, you're downloading or you're connecting to existing services. So, the idea would be you start with some pilot sites, download, connect, train, do a little TA. You'll probably end up creating materials as you go. You'll learn a bit as you go and so forth. And so you want to adjust that as you go. And then, once you get everything running and up and implemented, you're really just kind of monitoring and feeding back information. So it's you're not actually having to do the work, or you're not having to run those case managers, or you're not having to run those call centers. But, once again, in some situations you're going to have to do that. But in general, if you design it right, you shouldn't have to at all. At this point, it's kind of to just sit back and just kind of show you some of the things that Patient Tools can do. Obviously, we've been laying all these pieces out and obviously been working on this problem. I mean, we started with Grand County back in 2012, I believe, and we've spent many, many years working out all these different pieces, getting all these components that you can easily download. We've created content packages around hundreds of different measures and so forth. We have all the pieces that you need in terms of how do you manage those administrations in an office? How do you manage those administrations up on a website? How do you notify? How do you send out those texts or whatever? How do you send out those reminders? How do you manage those profiles? How do you manage those flags? How do you route the reports? How do you route the information off to other sources and so forth? That's all comes in your data exchanges. And those are all just configurable transactions that you set up. How do you lay out your dashboards? What kind of portal services do you provide? How do you brand things? I mean, there's just all sorts of things and tools that are available to you. And we'll just kind of run through a bunch of those right now. But end of the day, once you design your program, if you design it around the pieces that we're talking about, you're willing to go electronic, the whole thing just kind of falls together and you can just start out simple and download and start connecting and start going. So we'll run through some demos here. To help you understand how this could look in your setting, let's get into the a little demo here. So what we're seeing is a bunch of different ways that you can brand your portal. You can control that logo in the upper right-hand corner. You can control all the opening text. And this is a managed portal, so you have to go in through an email address, and then they can create their own passwords. They can even set up their accounts in the portal itself. But this is kind of the way to get down to individual organizations running their own portals. And once you're in, you basically, based on your email address, you're going to come up on profiles. In this case, we have some red showing up. That means that there are things that need to be taken care of. And so Billy worked their way into doing some screenings for this is an ASQ coming up here sort of thing. And the nice thing about computer electronic entry is that it does all your calculations for you, gets your prematurity right. Everything is screen by screen, so that works well. If you try to go to different sort of formats or run these on different devices, we actually shape buttons for audio. If you want to use those so you can describe it. It's adaptive. Like I said, it can go on to tablets or whatever you want, or smartphones. And you throw your figures in as well, and it can respond. It actually has a lot of logic capability internally as well. And so if we pause out of there, then we can go off and look at activities here. So we're looking at some activities for Sally. And this is another nice thing about using this portal, is that you can drop in and access these anytime. And then this also leads to potentially wanting to use a personal app for this as well, because then you can just access it anytime easily. But you can go in and do it by the whole worksheet, or you can track individually on each activity. The activities are set up by domain and by age, and so you can go and work on areas that are having issues or not. And you can track your progress and see where you're at. Very useful from the parent's perspective. A great way to come up with things to do with their child, just easily out of the box. And so, it's using inside the portal now. The next thing is, how do you get to the portal? Maybe a little bit easier instead of going through, say, managing a profile with an email name and a password, which people find difficult. So in this, like we did in webinar number 2, we showed how you could launch from basically a link inside of a text. In this case, we're going to show you how to do it from an email. And this one's popping through. So you launch it from your front desk. But that could have come from your EMR too, or potentially other ways of launching those things off. But the email is completely customizable. You just click on the link, you drop in, you check your security phrase, just so that's a quick way to make sure that you're not phishing and assuring your clients that you're not phishing. And then you're right into the questions at that point. There's no protected health information out in the portal. It's a managed portal at that point, but you're actually in the portal right now executing the same stuff you're doing on the other side, or as if you had gone through as a profile with an email and a password. But same thing when this all gets done, it automatically gets routed back to your agency or practice. It can be printed out. It can be moved into an EMR. It can be, the data is all recorded away. The other way to do it is, once you get past if you want to do it remotely before you get to the visit, in those cases where you are having a visit, then the easiest way is to use a PTI Office app. And then this one's running on an Android tablet here. And the deal is that you put in an ID, and then it goes back and looks and sees if there's something that matches up with that. If not, you have to enter that data, but it's the first time only. And it'll actually pick it up the second time you come back with that same ID. But you have to put a date of birth in here, because most of the stuff is set up around age-based protocols. So in this case, you could do any one of these 3 screenings here. And so you just click any combination that you want and go on through. You have to finish your information, pick your language, and then you go. Another way to do it in the office, which is probably a little bit easier, it's close to what you do when you come out of an EMR directly, but you can create a launch manually through the front desk. You could have looked up that profile and then pull up all the information associated with it, select what you want to have happen, and you launch it. But once you're on the launch list, you can go out in any tablet or kiosk, click on the list, and then select the name off the list that's already been set up. Click Start Now, and then you're up and going. And so here we are right back at that, selecting your language, and you just go on in. And so in this case, you're doing it on an iPad versus an Android. It doesn't really matter what kind of tablet or kiosk you go to. And kind of popping your way through. Once again, it's all screen by screen. It's basically, well, it's actually exactly the same formatting that was used out in the portal is being done on a local tablet. It's kind of like a little mini web server and actually running inside the app. And so you kind of pop your way through. We kind of flash to the end here just to show you, so they finally get done with all the different assessments they're supposed to be doing. Click back through. Now that's already routed through over to your EMR or print station or whatever you want to do with it. And so let's look a little bit more at front desk support. And so in this case, we're using a local front desk, not one up in the portal. And you can use any partial, just even a couple characters is usually enough to pull up a name. You can go in and manage that office information. You can go through and decide whether you're going to launch to remote or launch to local, into a tablet or a kiosk, as we say. And then, within those, you can have different configurations on those targeted devices that you're going to. And you can go through and set up, if you're going remote, you can set up the how contact, so you can select that email versus text. And then the other things you look at is, if you want to, this particular profile is profile connected is the way we refer to it. But you can also go practice connected, and there you just did a launch. So a lot of management of the profile itself. The other thing that you like to do on the front desk is that, say something was done out in one of the portals and you don't know that it was coming in. You can get a notification that something's happened, but you're not going to get details. It's not a secure way to go. So you just go to your screening list, and you can see what all has come into your practice. And you can look across your practice, you can look across connected practices, or you can look across all the profiles where they're connected to that are profiles that you are connected to. It's a little bit of a reach there, but that's how you can look across all the different organizations associated with a profile. You can get into the summary, you can get into the full report. If you click through on the individual, you can see the information about that individual, previous assessments, and you look at that flag information if you want to go there as well. Finally, you get into managing flags. Most of the time you try to do that from the central page, not on the individual basis, but this is more for a call center. The big thing here is to manage that next contact, which automatically sets those up on your list in order there. And then you can filter down. You can assign these to different individuals within, say, a call center, or basically to break them up. But it's a great way to track all your notes, to track what the status is, and then be reminded the next time you need to contact that person. So it does that full call center support sort of idea. And then once again on these, if you get to the point where you're maybe you need to get more detail about the individual, you can always click through on the green there and you pop through to the individual profile details. And in that case, then you get into, here's all the flags and all the screenings associated with that individual. And you can get a full, basically a full trail of information associated with the entire episodes and any sort of flag that was generated at the screenings, an initial. So you end up with a nice little system where you can actually track everything. You can look at everything. The last piece you might want to do off the front desk in a typical situation is to manage that launch list. And the big thing here is you want to potentially either send reminders, which you can do through the actions, or you can redirect to an internal location and so forth. So that's a good way to, if somebody doesn't get it done in the portal, you can just bring it back inside. Then let's look at a print station real quick. These are really, really simple. They just run in the background. You can even set them up as a service. But any screening on any device can be routed to a specific output location. And then the typical sort of thing, we call it like an inbox sort of interface to an EMR or other systems. You either put out a hard copy or you put out a PDF, or even coming out with a TIFF where you can totally simulate fax. But most systems will allow you to import the PDF, or you come into an interface like an UpDocs or something like that. Is a typical way to go in if you're not doing the full EMR integration. EMR integration, you obviously bring it in as lab data. And then the last area to get into is your aggregate information. So you want to be able to pull up, looking across. You can look across many different practices or just your own. You can set all sorts of filters, but most people work with just frequency tables. The last area you get into is, you can look at the individual records if you want to pull them up, and you can just put them out as a spreadsheet. Hopefully we've given you a pretty good idea of how you want to design a program to just make it work better. And so what it comes down to is you're expanding that reach, you're expanding that breadth, you're making connections, and you're expanding that engagement. And then off of that, you want to automate your process. So you take your connections and you distribute your workload out. And then within any of those screening sites or care coordination sites, you get those folks to actually use as much automation as possible, so they don't, essentially like in a medical facility where you've got fully integrated, seamless integration to the EMR. You can run directly from the scheduling inside the EMR out with a link or out into a portal, back right into the EMR as lab data and summary notes and so forth, so that staff at the individual medical facility doesn't even have to be involved, and it just shows up in the medical record. So, they just, those levels of integration and so forth, and simplifying that process using the automation. And then from the cost perspective, if you distribute everything out and you get all these other organizations to do their own work, they will be self-sustaining. It becomes part of their process. The cost becomes part of their normal operational expenses. And in many cases, or actually I should say in most cases, especially when you engage and realize that most of your screening will be done through medical facilities, then that cost can actually become a profit center for them. They can get reimbursed for those activities, or it becomes part of their capitated cost that they're charging for, and it becomes part of normal operations. And then there's other ways that they can make money off of that they have to consider as well. It's part of their marketing. It's part of their grant writing. There's all sorts of ways to make money off of screening. So, you can set up all these programs, but you just kind of help get them to do it themselves, sustain themselves, and so forth. So anyway, hopefully that helps. It's really not as hard to set up a program as you think. You just kind of have to think, try to get a little more social media savvy about the process. Realize that, this kind of is a systemic sort of thing. You got to approach everybody associated with the process probably in a different way. Understand that the needs are different in each location, but you can work all those things together, get them all networked together, and then create yourself essentially an engine that's just kind of working on its own. And then all you have to do is just monitor the process and feedback information. So it all works quite well. So anyway, hopefully this series has been good for you and been helpful. Basically down below, fill in any any comments down below. And then, if you're interested in exploring further, just fill out that contact form there and push that on in, and we'll connect with you and hopefully get something going for you. Anyway, thank you very much for your time, and we hope that you get involved. Take care. Bye.